welcome back to this segment on our channel called Answering Your Most Googled Medical Questions by Hada Gastro, and today's video is a super interesting and informative one. So let's get started. So in today's video, we'll explore the question, what do you need to know about the SARS-CoV-2 B11529 or Omicron variant? On 26 November 2021, the World Health Organization designated the new SARS-CoV-2 lineage B11529, now named Omicron, a variant of concern. Much is still unknown about the Omicron variant, and it is expected that the variant's real-world impact will become clearer over the next few weeks. So what is Omicron? In late November, a group of closely related viruses was identified from Southern Africa, which harbored a unique set of mutations, not previously seen with the other variants such as Beta or Delta. At the time of writing, Omicron also has been detected in European countries, the Middle East, the United Kingdom, and the Asia-Pacific region. So does Omicron spread more easily? So it is not yet clear whether Omicron spreads more easily from person to person compared to other variants. So while there have been increases in case numbers in South Africa around the time the Omicron was identified, the exact impact of the variant is still unknown. Does clinical presentation differ? It is not yet clear whether Omicron causes more severe disease compared to previous variants of COVID, and there is currently no information to suggest that symptoms associated with the Omicron variant are different from those of other variants. The list of symptoms the Centers for Disease Control lists for the Omicron variant includes fever or chills, a cough, fatigue, shortness of breath or difficulty in breathing, muscle or body aches, headaches, new loss of taste or smell, a sore throat, congestion or a runny nose, nausea or vomiting, and diarrhea. So can currently available tests detect the Omicron variant? Yes, the variant was detected through the use of routine COVID PCR tests, and there is no indication that available PCR tests cannot successfully detect this new variant. So is COVID reinfection with Omicron likely? So according to the World Health Organization update of 27th November, preliminary evidence suggests that there may be an increased risk of reinfection with Omicron, meaning people who have previously had COVID-19 to become reinfected more easily with Omicron, as compared to other variants of concern, but information is still limited. So how effective are the current vaccines against Omicron? Data is still limited, but based on the significant mutation seen in Omicron, it is possible that partial immune escape might happen. But this was also true for previous variants of COVID-19, where vaccines continue to provide high levels of protection against hospitalization and death. And even though Omicron may spread rapidly and reduce but not eliminate the effectiveness of current vaccines, vaccination is still a crucial measure of risk reduction, therefore remains highly recommended. And so what now? So while data on this variant is awaited, it is key that non-pharmaceutical interventions like social distancing, masking, ventilation, and sanitizing continue to be followed, and that vaccine update is still encouraged. And that brings us to the end of this video. Thank you guys so much for watching. Please make sure to like, comment, subscribe, and share. And please make sure to turn on your bell notification so you'll be notified every time we have a new update. If you would like to help us make better videos and content, you can also donate to us via PayPal. Take care, and thanks for joining me today as I explored the basics on the new Omicron variant.